Do you want to be a youth, and how much young are you? How to test it in the most economical, reasonable way? It's by testing your levels of DHEA in your blood. So that is called the youth hormone, and its role on eye health and overall health. That's what we're going to be talking about. Just jump in. So DHEA means dehydroepiandrosterone. And in sulfated form, it is excellent for a body. So it is a naturally occurring hormone produced by the adrenal glands. It's also there in the brain, skin, and other parts. It acts like a precursor to both male androgens like testosterone and female hormones like estrogen, progesterone. So DHEA peaks in the age of 20 and steadily starts declining down by around 40, 50, 60. The levels keep dipping. So why it does so? Because of our day-to-day life, the food which we take, the stress which we do, the DHEA levels keep dipping. So if you want to know how much your actual age is, there's something called the chronological age and also biological age. Biological age is how much cells are aging, and chronological age is from your date of birth to today. If you calculate, that is your date of birth. That's your chronological age. So if DHEA levels are declining, what happens? We get fatigued, we are not able to think properly, and we get irritated, and we start having small immune problems, cough and cold, catching cough and cold very often, having digestive issues, 2 eye conditions, retinitis pigmentosa, macular degeneration, diabetic related complications, glaucoma. All these are coming because of, if you don't have proper DHEA levels, the hormones are not secreted properly, and hormones are not there, you start having whole lot of chain linked reactions, because these hormones are very much required for our brain and the eye and other things as well, because it modulates immune response, it controls the inflammation. So everything is any part of the problem in the body is related to inflammation, immune reactions, and the cells getting damaged because of oxidative stress. So all these are controlled by DHEA if you have good DHEA levels. So in the level of how DHEA works, it converts into testosterone or estrogen depending on what the body needs, and anti-inflammatory actions by modulating cytokines and reducing the oxidative stress. It acts as a fantastic neuroprotection, supporting the nerve health in both the brain, optic nerve, retinal neurons, etc. It boosts mitochondrial function, improves energy production in cells via meaning stepping up in the retinal metabolism. So in the eye diseases, as I told you, DHEA sulfated form has tremendous protective roles in eye health, where it decreases the oxidative stress, and also vascular damage is decreased. It also makes the blood RBC more pliable. It's very helpful for conditions like RP, macular degeneration, dystrophies, glaucoma, and diabetic retinopathy, to name a few. A lot of conditions it can be helpful for in the eye, and in the overall body. It is DHEA, if it is increased, that means you're anti-aging. So if your DHEA levels are low, which means you're aging ahead of your chronological age. So it's a very simple test, and in diabetics, the DHEA levels tend to be low, which means there's damage happening, and animal studies suggest that DHEA supplementation could reduce retinal vascular damage. Glaucoma, optic nerve disease, similarly, it can help in all those things. It prevents apoptosis. What is apoptosis? It programs cell death. So this neurosteroid properties of DHEA helps in protecting the retinal ganglion cells and preventing apoptosis. This could complement the therapies which we are doing, like stem cell therapy, PRP, and diet, meditation, pranayam, oxygen therapy, ozone therapy. All these things are being done. Along with it, if we take the right kind of diet, DHEA levels are high, it supports them very much. DHEA also synthesized locally in the lacrimal glands and meibomian glands. The topical or systemic DHEA may improve tear production, reduces dryness, and enhances ocular surface health. So, benefits beyond eyes are its tremendous energy booster, mood booster, and memory booster as well. It has tremendous better immune modulating properties. It's stronger for the bones and the skin hydration. It helps. And also, very importantly, sexual health improvement is there. A lot of people who are seeing for those revenues. So what are the side effects and risks? Like all hormones, DHEA must be used carefully. Acne, oily skin, unwanted hair growth could be there if not given by trained professional. Mood changes could be there, irritability, aggression could be there. And risk in hormone sensitive cancers, yes, of course it is there in prostate, breast and ovarian cancer. There are, it could aggravate them. Menstrual irregularities in women could be possible, and sleep disturbances also are one area. So, how is DHEA used? We give in as oral supplements based on the need, anywhere between 25 milligrams to 50 milligrams per day. The most common form is tablets. Others are topical gels, creams, which are used in anti-aging and skin rejuvenation. Vaginal creams also are being used for dryness and libido in postmenopausal women. It's also given as sublingual drops because of its fast absorption. Experimental eye drops also are being done as a research for ocular surface and neuroprotection. Amazing. So, very important to note that DHEA levels in the blood should always be checked before the supplementation. Medical guidance is essential, especially for patients with diabetes, cancer risk, or eye diseases. DHEA can be synergistically combined with vision therapy, photobiomodulation, stem cell therapy, nutritional supplements, oxygen therapy, ozone therapy for comprehensive eye health. So, if you to take home messages, DHEA is more than just an anti-aging hormone. It plays a very, very crucial role in protecting the retina, optic nerve, ocular surfaces, etc. With careful supervised use, it becomes a fantastic lethal weapon to protect degenerative eye conditions like RP, macular degeneration, diabetic retinopathy, glaucoma, etc. So, if you have any doubts in this DHEA levels, how to check, whom should be advised, how much supplementation to take, all these things, you can either reach out to us on the phone. Most importantly, if possible, do come in person and we'll have a discussion and take it forward. Thank you, Dr. Sashi again.